Good morning. This is Dr. Timothy Scott Becky. It is October the 27th of 2021, and the Lord has blessed me with another day to serve, and hopefully you're doing okay. If you're not, let us know, okay? And we'll try to help you. I want to go ahead and give you talk about our clinical pearl today, or something you can use. And I want to talk about melanoma. Now, I talk about us doing skin surveys, and we do those annually on every patient if they let us. But I want to go just talk today about melanoma. So melanoma is really categorically the biggest, most prominent skin condition that will actually kill you. Okay, and it's cancer, and it doesn't act right a lot of times in the sense that it kind of can come and go, and it's weird, and we always think it's due to skin exposure or sun exposure to skin. But that doesn't always correlate, and they pop up in weird places. And that's what I'm always on the hunt for when I'm doing my skin surveys. So let's talk a little bit what I'm looking for. So in a real simple term, if you have a freckle or a dark looking skin lesion that pops up, and it looks like it's growing, itching, bleeding, or anything close to any of that, I want to see it and I want to take that thing off of you. Okay, but we do have a little bit of a mnemonic that we use for melanomas, the ABCs of melanoma. And what the ABC stands for is it asymmetric? Does it have irregular borders? And is it multicolored? Okay, if it has any of those three characteristics to it, I'm interested in looking at it. I want to see what it is. I want to possibly take it off if need be. And what we do here in the office, and we're pretty good at doing this, is we do biopsies of the skin lesions. So if you have a skin lesion, something like that is bothering you, or you've seen it, you want it looked at, we can see it. And very rapidly, and on that visit, a lot of times if I think it's something that needs to be taken off, I take it off right there on the spot, or at least get a piece of it right there on the spot, and I send it off to a dermatopathologist, which is a dermatologist that specializes in microscopic skin and can tell whether it's a cancer or not. So that's what we do. We send it off to Memphis, Tennessee, and it gets evaluated, and they send it back to me and say, hey, this is nothing, or B, this is not something really bad, or it can be in between, where we have irregular lesions that are not melanomas, but they're irregular enough that we want them taken off so they don't bother you in the future. So we offer those services here. I'm not a dermatologist, I'm an internist. Okay, but I am well trained and in identifying skin lesions as a primary care doctor and removing them expeditiously so we can get you taken care of and hopefully prevent you from succumbing to a disease that is preventable. And I usually will get I'll find 2 or 3 melanomas a year, and and I feel like we're making a difference in those people's lives because they're taking that risk away from them. So, all right, let's talk about COVID real quick. COVID-19 is still in the area. 2,098 cases were reported. We're still battling it. I know there's several isolated groups in town of families who are experiencing the COVID right now, and we're trying to help them. Okay, again, just be careful out there, and we've got our treatment regimens. I'm going to say this every day. I think of it, but if you are questioning whether or not you should get the vaccine or not, I will talk to you and I will give you my best answer on that. I understand the controversy. I understand the misinformation, the lack of consistent information, the skepticism. I think that like the media has. I really don't feel like you can trust the media, or actually you can trust the media is telling you something other than the truth. That's the only thing I get out of them. That's the only thing I trust in them now. They're very consistent with that. And so I'm here with you. I'm experiencing this thing in real time, and I'm seeing what it's doing to people, so I can give you my best answer based on my clinical judgment with what I see every day. Okay, and it's different than what they're doing, and it's not. I don't have a ton of accumulated data and studies and everything, but I do feel like I've dealt with this now. We've dealt with it enough that I can hopefully give you a great answer. Okay, when it comes to whether or not you should get the vaccine or not. Alrighty, we're still looking for brick buyers for Place of Hope. So if you want a commemorative brick, I recommend it. Otherwise, this is Dr. Beck signing off for the day. Please call us if you need us, and enjoy this beautiful weather. Thank you.